Well, hey guys, Dr. Ben here. I want to talk to y'all today about headaches/migraines. This is a real big question people have when they come in. Super exciting about chiropractic. I don't know that there's a headache that we haven't seen go away, or at least, minimize like crazy. One of our patients, Jennifer, 22 years of migraine headaches, worked at a fire hall, in fact, which by the way, I can't even imagine that. She was like the receptionist for the fire hall. And she's having 2 migraines a week for 22 years, has 4 kids. I couldn't even imagine the amount of pain that woman's been in. She's had Topamax, she had all of the pain medications, plus even injections into the small muscles in the lower part of the neck. She came in, she got adjusted within 2 weeks, hasn't had a migraine, and that was 6 years ago. So I kind of wanted to explain to y'all, I had an opportunity to explain this with somebody. I thought, you know what, why don't I just put this on video so that y'all can see this, you can rewind it, and I'm going to kind of explain the physiology of how this works. This is going to be a pretty succinct explanation. So basically the back of the skull, right? So if we were to put a skull like this, okay, you have 7 vertebrae in your neck. The top one is kind of like a ring, so it kind of looks like this, right? And then you have squares after that, right? So we're going to call this the first vertebra, second, third, fourth, fifth, sixth, seventh. Okay, the ones that we really want to know about with headaches are these ones right here. Okay, so basically what happens is there's a couple of really large muscles here that form what we call the suboccipital triangle. That's what that is. So you've got a big muscle that goes right here. You got another big muscle that basically hooks to the top bone, and you got another big muscle here that hooks to this second bone. And the purpose of these muscles are actually to move your neck, flex and extend it, and I'll tell you how they get injured here in a second too. So we have the word minor over major here. Then you've got this muscle that comes out here, then you got another muscle that comes out here. So these are what we call the suboccipital triangle here. And so what happens is these muscles are postural muscles. So we are, actually there's one right here too. So basically these postural muscles, as we're sitting over computers, these little muscles up here get tired after a while. And when a muscle gets tired, essentially just like a strained muscle, like if you strained your bicep working out at the gym, it has to repair itself in scar tissue. Actually it lays down scar tissue to repair itself. Well, a muscle that's supposed to contract, you gotta realize when the muscle fibers are nice and straight and lined up, that muscle can contract and expand, and those fibers can run inside of each other. Well, when you injure it, right, in some way, those muscle fibers can't contract anymore. So what your body does is your body lays down scar tissue to try to heal that, and then that scar tissue is supposed to break up so these muscles can do this again. The problem is when your body lays down this scar tissue right here, if there is a nerve, right, we're going to put the nerve in red, that happens to be running through here, what happens is that scar tissue will grab a hold of that nerve. Well, let me tell you, if you have a nerve coming out the base part of this neck, specifically through this triangle, you have a nerve, by the way, that comes out of here. It's called your greater occipital nerve. It comes out of your second cervical vertebra, and it's the nerve actually that goes up the back of the head. It's the one that goes over here by the temporal region, and actually can go down back behind the eyeball. So it's probably the most common headache behind the back of the head, behind the eyeball, and out in that temporal region. That's called your greater occipital nerve. Well, that nerve exits kind of in the middle of this suboccipital triangle area, and what happens is when we injure these little muscles, so again, that could be a whiplash. For a lot of people, it's whiplash. I'll be honest with you, sports injuries, car accidents, you name that, whiplash, or it can be sitting over a computer, right? We'll injure that muscle, and then your body lays down that scar tissue, and that scar tissue hooks on that nerve. So now every time you try to flex this muscle, that nerve is just getting torqued on, right? And when it smashes on that nerve or pulls on that nerve, it'll shoot that pain up the back of the head behind the eyeball. And that is actually exactly what happens, and it usually gets hooked right here, or actually probably more common even, is it'll get hooked right here. And you'll know this because if you have one of those headaches, and most people will say this, it's like they can find this spot like right here in this base of the skull, and if they just push on it, it feels like it relieves things. It's like that's the spot right there. Well, let me tell you, if that's what you have, there's two things that we have to do to fix that. Number one is we have to move the bone, because when the bone gets out of position, it causes that muscle to spasm and pinch the nerve. But number two is we have to strip some of that scar tissue out of that muscle. There's a very specific technique called ART, stands for active release technique. There's some other releases that we do to strip that out. I know it sounds like kind of painful, and it kind of does hurt so good. But the big thing is at the end of the day, what it is we strip that out and headaches go away. I mean, I can't tell you in my career how many thousands of headaches we see be relieved by the time the person gets from the table to their car. Like before they even leave the office, like within 5 minutes, they're like, wow, my headache is like 50% better, 75% better, or maybe even completely gone. For those people that are suffering with migraines, we have to do a little extra work to strip out those muscles. But it's really this simple. And again, that's a greater occipital nerve. There's these muscles in here called your suboccipital triangle, and you're dealing with scar tissue. And you think to yourself, man, it can't be that easy. Well, guess what? It really is that easy. It's not rocket science. God did an amazing job, building our bodies. We beat it up. But what we do in this office, at the Well office, is we strip that out. So anyways, if that's you or somebody you know, pass it on. And appreciate y'all listening. I'm Dr. Ben.